Hello, my name is Shannon Bohannon, and I'm going to be presenting an oral case presentation today on a 4-year-old male. He presented to the clinic today for his 4-year well child check. His initials are AS. He does have a history of clubfoot that was status post casting repair at birth. He has had no reoccurrence of his clubfoot. He received ECI, which is like an early childhood intervention physical therapy, until the age of 3. But his mom also reports today that she is concerned that he is still speech delayed. She says that he's hard to understand. She has behavior concerns, including that he doesn't like to play well with others, that he has temper tantrums, and that she is unable to potty train him. So his birth history, he was vaginal delivery at 38 weeks plus 3 days. He was average for gestational age. His weight was 3803 grams. His length was 50.8 centimeters. His occipital circumference was 36.5 centimeters. Apgars were 7 and 9. And his O-top blood type was O positive. His mother's pregnancy history, she's 26 years old at the time of his birth. She was gravid peritu. Her prenatal care began at 12 weeks and she received 10 visits. She did not have any significant prenatal history. Her blood type is also O positive. His vital signs today, he is 103 centimeters tall. He is in the 50th percentile for his height. His weight is 17.7 kilograms. He is in the 75th percentile for his weight. His blood pressure is 89/48, temp 98.5, heart rate was 89, and his respiratory rate was 20. He lives with his mom and his grandma, both of who accompanied him today to his appointment. His diet consists of just table food, snacks, just meals that he eats with his family. He drinks diluted juice. So we did try to deter mom away from giving juice like that, and so she felt justified, being the fact that it was diluted. We tried to encourage more, at least milk at least twice a day, and to introduce more plain water. Like we said before, his urinary output, stool output, is normal for his age. He has about 1 to 2 stools daily, goes to the bathroom 4 or 5 times a day. However, he is not potty trained. Mom said that she has difficulty getting him potty trained. He just refuses to. He goes, in his underwear or in his pull-ups, and he refuses to be potty trained. He brushes his teeth at least 1 time a day, but he has not seen a dentist. He sleeps about 8 to 10 hours a night, takes 1 to 2 naps a day, and he does sleep in his own bed. He has good vision, good hearing. He is developed. He was walking around the clinic office. He did not have shoes on. He did have his socks on. His feet appeared, they were normal. The speech delay development that mother was talking about, I could understand him. I didn't assess a speech delay myself. He interacted well with me. He had a little small computer that he was playing with. He and was able to articulate that and operate it without any difficulty. So he does not attend daycare. He is at home. His mother says he is trying to get him into a school. However, she is unable to be successful with that due to the fact that he's not potty trained. He sits in a car seat. There is a smoke detector, CO2 monitor in the home, and the home is child-proof. He has not had any major hospitalizations for any kind of illnesses, and he has not had any surgeries. Again, the clubfoot repair was done through casting. The only medications that he takes are his pediatric Claritin as needed. He is not allergic to any medications. He does have a family history of autism from his maternal uncle. Via symptoms today, he presents no fever, no chills. There is no He denies eye pain. He denies any problems with his vision. They did conduct vision screening. Upon his arrival, was normal. There's no drainage from his eyes. He denies any ear pain. There's no nasal discharge. He denies sore throat. He was speaking clear, no hoarseness. He denied any chest pain. He denies any cough, any shortness of breath. He denies any abdominal pain. He denies any vomiting, no constipation, no diarrhea. Like I said, he is not potty trained. There is no, mom says there's no foul odor. No joint pain. No, they deny there's no swelling or anything. Like I said, he answered everything appropriately. His objective exam, he was alert, interactive. He looked well nourished. He looked well developed. Pupils were equal, round, and reactive. Normal accommodation. There was red light reflex present. His ears, the TMs were intact. There was no erythema to his ear canals. Good dentition. Pink and moist oral mucosa. His neck was supple. No neck masses were observed. Trachea was midline. There was no respiratory distress. Lungs were clear to all fields. Heart sounds was normal, S1, S2. No murmurs were detected. Cap refill was normal. Bowel sounds were active in all quadrants. There were no masses palpated. He had normal posterior and anterior cervical nodes. They were normal in size and they were not tender. He had good muscle strength and tone. Like I said before, he was walking around and playing in the clinic office. Clubfoot seems to be resolved. He did not have any trouble with ambulating. There were no rashes. Skin was normal pigment for his race. No rashes, no lesions. He is not circumcised. And there were 2 testicles. So the assessment for him today is speech articulation delay, history of clubfoot ×2 resolved, and suspicion for autism spectrum disorder. So he will be sent for screening for that. We did review with him on our plan for today the milestones that he should be reaching at 4 years old. He should be brushing his teeth independently. He is not. He should be able to dress and undress himself independently. He is unable to do that. He can speak 4-word sentences and his speech 100% understood. Now, despite what his mom says, I was able to understand him. He asked full questions of me. He asked me what my name was. He asked me what I was going to do. He asked questions and I was able to understand him. And he is able to climb stairs. One of the milestones he should do at 4 years is he's able to climb stairs 1 foot at a time. And despite his history of clubfoot, he is able to do that. So we are going to continue. We are going to refer him back to speech therapy and OT, and we are going to do what is known as ADOS testing. This testing does assess for autism on this patient. Today, being 4 years old, he is going to receive his MMRV vaccine, his DTaP, and his polio vaccines. Prior to that, he was up to date on all vaccines. The lead screening was done. The TB questionnaire was performed. Those are all come to be negative. And we will see him again at his 5-year well child check or sooner if needed. That is all. Thank you.